Hi there, Todd Cameron here, GP and Medical Director at M3 Health. This is a general message for members of our community about some really easy actions you can take to reduce the impact of coronavirus on yourself and your local community. We're doing things in our general practice to pivot within 4 days to providing all consults via the telephone, so we're not bringing people into an environment where we can potentially spread things. But I want to talk to you in this video about what it is you can do. They're really practical, simple measures that you can invoke now. So I've broken this down into behaviours, environment and community minded. So what behaviours do you need to do? Well, the first thing you need to do is remove the normal habits of kissing, hugging, handshaking with anybody in your network. And yes, that does mean your family. Unfortunately, it's going to be really hard in some circumstances, but there's a fairly good chance in this that children remain very well with coronavirus. They may display little to no symptoms at all, and therefore close contact is going to be hard to avoid, and we don't want to be doing the things that make it easier for this virus to spread amongst us. Generally speaking, as people get older, it gets more serious, and as people have other, we call them comorbidities, other illnesses, heart disease, respiratory disease, immune diseases, diabetes, etc. All of those things mean you're more likely to have a more serious infection, and we don't want that. We want to keep people out of hospitals, and we want to keep people safe and in their homes. So our first priority is safety. So the behaviours are avoid kissing, touching, hugging, handshakes, etc. Regularly washing your hands. So, 2 lots of happy birthday. I strongly recommend using your own name rather than to me. It just sounds better to my mind. You do get to do 2 lots of hip hip hooray, 2 lots of 3 hip hip hooray. So happy birthday twice, hip hip hoorays at the end of each. That's about 20 seconds. Wash your hands properly. You've seen our surgeons do it. Good lathering of soap. That's better than anything else. Alcoholic hand sanitizer is fine if you can't be near a tap, but hand washing with soap and water is much better. So do that, please. Be meticulous with that. Try to not touch your mouth, nose and eyes, because that's how you can easily spread it. The other things we need to be doing is social distancing measures. This is probably less relevant in your home, but start increasing the space that you ordinarily have between people. 1.5 metres is a good amount of space to have as your minimum. That's people who play netball know 1 metre about where they need to stand. So that distance again will be a good basis to work from. It'll feel really weird and abnormal, but 1.5 is the closest people should be. 2 metres is good. 3 metres is better. We're all going to have to get better at managing these things. Avoid touching surfaces that people commonly touch. So that would be things like handrails, doorknobs, that kind of stuff. One thing that I would completely stay away from is touch screens and self-serve stations, at supermarkets and places like that. If you do need to use a touch screen, so one I can think of is the ATM. We're all going to need to get money. You're going to need to make sure that you wash your hands after you touch an environment like that. Do yourself a favor, set up Apple or Google Pay if you can on your phone, because it just means that payments above $100, you don't need to enter a PIN code. So that's going to be useful for you to avoid touching surfaces. So that's an important one. And community minded. So this is really important. This is one of those environments whereby what we all do actually helps everybody else as well as ourselves. So we're going to need to make sure that we're looking after the people that are elderly or vulnerable, people that have other health issues in our communities. Do not have gatherings of people where someone is sick. It is probably unintelligent to have gatherings of people at all. And if you do, you should obey those social isolation rules in terms of social distancing rules are going to be really important. I will put together some content on people that need to self-isolate or self-quarantine, depending on if they're well or unwell, isolation being the people that are unwell. So we'll put some more content out here. This will go into our Facebook channel. Do yourself a favor and subscribe to this channel in YouTube. You'll get further updates that way as to what's going on. I hope that's been useful so far. Let's do what we can. It is worthwhile having somewhat of a an amount of non-perishable items. And if you do run out of that, then hopefully one of your friends or family can get it for you and deliver it in a timely manner. You may not be able to rely on deliveries when a lot of people are seeking the same thing at the same time. This is a time for us to be bold and to pivot quickly to what we know makes a big difference. This is not a time to freak out. This is not a time to start bluing. This is a time to pull together, do the best we can. We've got this.